Hi, my name is Emily, and I'm a student in HAP 360, and I will be teaching the Comparative Effectiveness assignment. A comparative effectiveness study compares two different approaches in healthcare to see which one is the most effective. This can lead to better quality care and lower healthcare costs. The purpose of this assignment is for part one, we want to identify two patients in the provided data that are matched controls, usage of lowest random number to choose other possible controls. We want to create a Kaplan-Meier survival plot of patients that did not fall. For the second portion of this assignment, we will be analyzing decision trees. So for part one, we are given this table of data, which has 9 patients, whether or not they received intervention, their ages, their months to their falls, or if they've not fallen at all, which is indicated by blanks, and then a assigned random number. So for the first question, we are asked to pick two matched controls. Patients 1 and 3 were the only two that had to have intervention, so they have been chosen to be the matched controls, which patient 1 will be referred to as case 1, patient 3 is referred to as case 2. So then our other matches will be based off of age. So to do this, we first need to find the standard deviation of the ages, which can easily be calculated using Excel. So the first thing we want to do is take the given data and put it into a new Excel spreadsheet. And then to find standard deviation, we want to just click on any blank cell in this spreadsheet and type in equal sign STDEV, followed by 2 parentheses. In these 2 parentheses, we want to add the ages of the patients. So for this, in this picture, we see that C3 through C11 are the cells that contain the ages. So between the parentheses of our standard deviation function, we want to type in C3 colon C11, and this will insert all of the ages and calculate the standard deviation of them, which equals roughly 8.89. So now that we have the standard deviation and our matched controls, we want to choose controls of these cases. So first thing we're going to do is find the ages of our cases. So for case 1, which is patient 1, we see that the patient is 65 years old. For case 2, which is patient 3, we see that the patient is 84 years old. The second thing we're going to do is add and subtract the standard deviation from these ages to get an age range for each case. So for case 1, we add and subtract 8.89 from 65, and we get an age range of 56.11 years old to 73.89 years old. For case 2, we add and subtract 8.89 from 84, and we get an age range of 75.11 years old to 92.89 years old. And then the last thing we're going to do is find the patients that fall into these age ranges, and then to choose our controls, we're going to choose the patients in these age ranges with the lowest random number. So for case 1, 8 and 9 were patients that fell into this age range and had the lowest random number. And then for case 2, 4 and 6 were the patients that fell into this age range with the lowest random numbers. So here we have our case breakdowns, which the first table is for cases, which are patients 1 and 3, and then the second table are the controls that were chosen in the last slide. So both tables go over the span of the 4 months in the study, but for the first table, we see that we only have 2 patients at risk. Second table, we have 4. So for the first table, we see for the first 2 months there were no falls. So first fall in that column we see the value 0, and no fall the value is 2. And then our second to last column is the amount of, or the no falls over the amount who have not fallen. So we see that ratio is 1 for the first 2 months. And then our last column is the percent who have not fallen, or who have never fallen through the 4 months. And for these 2 months, we see that the percent is 100. However, in month 3, we have a fall. So in the first fall column, you see that the value is 1, and no fall value is 1. So no falls over have not fallen, that ratio drops to 0.5, and we see that the percent never fallen is now 50%. And then that percentage remains through the next month. For the controls, we see for the first month there are no falls, so our no falls over have not fallen is 1, and then our percent have never fallen is 100. However, in the second month we see we have 2 falls, so our ratio drops to 0.5, and we see 50% have never fallen, and that percentage remains through the rest of the months. Here's our Kaplan-Meier survival plot. This was just created in Excel using the graph functions. This is just the data and the tables in the previous slide in a graph form. And we see the months are the x-axis, the y-axis is the percent that have not fallen. Our controls, which are patients 1 and 3, not our patients 1 and 3, are controls that were chosen in 2 slides ago. And then our cases are the orange line. So for the second part of this assignment, we've been given these 2 practice pattern trees, one for Dr. Smith, one for Dr. Jones. So we're asked 3 questions to answer based off of this data. The first question is, what is the expected length of stay for each of the clinicians? The second question is, what is the expected length of stay for Dr. Smith if he was to take care of Dr. Jones's patients? And then for the third question, we see the vice versa. What is the expected length of stay for Dr. Jones if he were to take care of Dr. Smith's patients? So for the first part of the first question, we see here I've broke down each branch in this. So for this table, the first column is each branch. The second column takes the breakdown of each part of the branch. So for the first one, we see previous MI is 0.25, and for congestive heart failure we see is 0.15. So for this column, the second column, we see that I've multiplied each probability to get an overall probability. For the third column is the length of stay, which is given right by each branch. So, and then the last column here is where I've multiplied this solved probability by the length of stay to get this value. And then at the end, all of these values were added to get the expected length of stay for Dr. Smith, which is 3.62 days. Now we see the expected length of stay for Dr. Jones, which we just went through and did the same thing, but on Dr. Jones's tree. We listed each branch here. We've multiplied together the individual probabilities to get an overall. We've just listed the length of stay here, and then the probability was multiplied by the length of stay to get this value. And then these were all added together to get an expected length of stay of 4.67 days. So we see that Dr. Jones has a longer expected stay than Dr. Smith. For the second question, we have listed Dr. Smith's branches here, but we've used Dr. Jones's probabilities. So for MI and CHF, we didn't use the probabilities that were given here in Dr. Smith's. We've used the ones that were given here in Dr. Jones's patterns. And then sorry about that. So then we see here we get the overall probabilities again, just using Dr. Jones's probabilities. And we use the same length of stay for Dr. Smith. And then here we have probability times length of stay. And then we add these together to get the expected length of stay, which would be 4.26 days. Now we have the opposite here, which is if Dr. Jones were to see Dr. Smith's patients. So we listed out here the branches. Here's Dr. Smith's probabilities used to calculate this overall probability. We have the same length of stay for the same length of stay column that's been there, and then we just multiply the probability by the length of stay, get this value, and we add these together to get this expected length of stay, which is 3.7. And that's it.